Thank you very much, Mr. Chairman. I want to first associate my words closely and completely with the gentleman from Ohio, my Republican colleague, who said that whether it's $750 million or $750 or $75 of fraud, we need to be out there trying to stop it. And I wish we could get the same level of commitment to stopping it that is being voiced regarding poor people, as was evidence yesterday when Dr. Clausen told us of $100 billion of tax dodging that was occurring, of profits earned here in America that were sheltered in some offshore tax haven. But there wasn't similar enthusiasm for that, or that we could get the same level of enthusiasm when pharmaceutical manufacturers defraud Medicaid, as happens one time after another. But we can't seem to get the same level of enthusiasm about that kind of fraud. That doesn't mean we shouldn't address it here, but it does mean that there's a great inconsistency. Now, as to Mr. Kelly, the gentleman from Pennsylvania, I know we got his Irish up, but you know, I don't think he's from a different galaxy. I see what the problem is because I looked at the document that he put in the record. And it's from Fox News, gentlemen. If you're listening and getting your information from Fox News, you do appear to be from another galaxy. So they put out a statement that illegal immigrants benefited from up to $750 million in Obamacare subsidies. But if you look at the original Government Accountability Office, I would tell the gentleman, they didn't find $750 million, they didn't find $750, they didn't find $75, they didn't find 1 red cent in their report. They discussed the amount of the subsidies that had not been eventually documented. They talked about the processes. They did not show that one immigrant took $1 improperly from this program. There may have been some, but none were documented by the Government Accountability Office. Now, my concern here is that the sponsor of this amendment made very clear when he introduced the bill that he was out and about to get at undocumented immigrants. In fact, he called them illegal immigrants. And he said that he wouldn't vote for Trump Care if this provision wasn't added to the bill. Now, while I want to prevent fraud, I also represent a number of families that have great difficulty, that have many barriers put in their way in getting access to health care. And many of these are children. That's why I asked Mr. Barthold the question about children. Many children that are out there, especially of working poor families, do not have a Social Security number. And I believe that Ms. Sanchez and Ms. Chu have both spoken passionately about the needs of those children. When they have a serious health care problem and they need access to a family physician, we ought not to be putting another barrier in their way. And that is just as important as protecting taxpayers, is protecting our neighbors, our disadvantaged neighbors. Many of our neighbors in hard-working families that are out there trying to make a go of it and comply with the law and to provide for their family. And why we would want to take steps to put more barriers in the way of children from those families, I just can't see it, except it growing out of the spirit of the author of this amendment, who says no Trump Care vote unless you're willing to do more about undocumented immigrants. We do need to do something about undocumented immigrants. We need to approve comprehensive immigration reform. But there's been an unwillingness to do what would be a major generator of economic growth and jobs, much more than some of these phony tax bills. There is a chance to do that ought to occur, but this particular bill ought to be rejected, especially for the reasons that my colleagues, Ms. Sanchez and Ms. Chu, have voiced, and I yield back.